want to stay with the story because to stay calm amid the spread of this new coronavirus, we all need to know how to discern hype from fact. Much of the media coverage has sometimes been questioned as far as what is factual and what is not. So let's speak to Pontsho Pilane. She's with Health eNews about the media's reporting on this. Pontsho, very good afternoon to you. Thank you for being on the lead. It's been a couple of days now since the first case was confirmed in South Africa. Have we as local media managed to strike the right tone in our reporting on this COVID-19?
I think just sitting here, Thembi, listening to you with the MEC, the questions you were asking, those are very important questions that provide clarity. So I think we've had hits and misses with our reporting from just, and it's a very hard one because when we're reporting on a public health issue, particularly like an outbreak, like the COVID-19 outbreak, what we're trying to do is we're trying to strike a balance between not being too calm and not freaking out. And that's a very hard balance to find. And I think we've been doing well in some instances, but sometimes it's just a little bit scary, or kind of like it for me, like as a journalist, as a health reporter, like looking at it, sometimes the reporting can be better to inform people on more on like preventative ways, like washing of hands, also like the symptoms. So not just reporting on the latest development, but also reporting on like kind of repeating certain factual information over and over again, because we don't know when readers or viewers come into a story. And so to ensure that we are giving the same information and all the same vital information over and over again.
And I remember with the first 7 cases, when we got the second batch of results, a decision was had, in our newsroom, about how there needs to be clear emphasis on the fact that those cases were related to the trip from Italy, for example, where we had the initial results come in. But I want to ask you about and I was reading a piece on this, how the lack of specialized reporting in South African newsrooms has perhaps influenced the way we report. We don't have a lot of health and science reporters who work in the space where you and Health eNews operate.
Definitely. I think one of the biggest issues or the challenges that South Africa's media landscape is facing is the lack of specialized reporters, as you'd said. The thing about being a specialized reporter in science or health is that there are certain terms that you understand. There's a technical way in which you read a study. There's a technical way in which we interview experts in order to get certain information. And we're also trained in taking that information and translating it into what I call human. Because, science it's not everyday language, and we need to make sure that people understand it. But the trick is to translate that science back into like lay language without losing the scientific accuracy. For example, I'm just going to revert back to kind of your interview with the MEC, Dr. Bandile Masuku. It's the first time I was hearing a report where the difference between self-quarantine and isolation was being asked of a health official or an expert. And that's very important because people don't know what the difference between self-isolation and quarantine is. And asking that gives people more information of if they think they are severe or they might have, you understand? Do you get what I'm saying? Like we're informing our viewers or our readers, the public, in a way that is helpful to combating the spread of the outbreak. So it's not just about reporting for clicks, reporting so that we have engagement, but reporting as a public good, particularly when it's a public health emergency like the one that we're seeing across the world right now.
Like with any other national or global issue, we've seen a lot of fake news reports circulating on social media in particular. In terms of the fight against fake news on issues such as this that just capture nations across the board, is that a battle that we've lost as a media? Because as soon as you report one fake post, the next thing comes up. And what's always surprising is even people who you would expect would be able to discern perhaps the difference between an eNCA legitimate article and something that's been forged onto a page will share that.
I think that speaks to something else, Thembi, when we're talking about the literacy, the media literacy that exists within our public, right? Do people understand, like you're saying, the difference between eNCA.com or eNCA.com Koza or something. Like, you know, those, I think about 2 years ago, we had a proliferation of fake news websites that were imitating the likes of eNCA, the likes of Sunday Times, EWN as well. So it's, I think when we see a public health outbreak like this, we're not just fighting misinformation on like general terms, we're also fighting the lack of understanding health literacy and the lack of understanding media literacy. So, for example, when the first case was announced last week, I was in the pharmacy, and one of the cashiers was already saying that there was a case that was reported 3 weeks ago because of the proliferation of forwarding messages on WhatsApp. So I think, I don't want to say we've lost the battle because that would be giving up, but I do think that we need to, that's why we have to repeat, like almost in a boring way, repeat some of the basic information about COVID-19. So, for example, the symptoms, the hotline, how to prevent it, what to do if you think you have it. And those kind of information should always be repeated because that will help in kind of like fanning the, not fanning the flames, reduce the misinformation.
The likelihood of misinformation spreading. I want to quickly get your final thought on this, Pontsho. The frequent briefings and statements by the National Health Minister, have those been helpful?
I think they have been, but in my opinion, right, like I just think we need to start thinking about more innovative ways of reporting on COVID-19, not just the new cases. You know, we're talking about self-isolation and quarantine. Have we thought about what would this mean for an informal settlement? If one person in an informal settlement could get infected with the virus, have we thought about what are the legal or labor implications for domestic workers, low-income workers, if they do get infected and have to quarantine? What are they going to be paid? And so I think we should take what the NICD and what the minister is telling us, but we need to take it further so that we kind of quell the panic about new infections with information to prepare in case it grows.
Pontsho, thank you so much for coming in this afternoon. Pontsho Pilane, she is a journalist with Health eNews, speaking to us then about the media's coverage of the coronavirus outbreak.